Greg Stevens. I am the chair of the Department of Public Health here at California State University, Los Angeles, Cal State LA. Thank you everyone for being here today, and we've got an exciting webinar lined up for you. I just want to give a little bit of context to this before we get started. In public health, we regularly talk about things like the social determinants of health. We often talk about the political determinants of health. Those are sort of the deeply rooted or underlying causes of disease, illness, injury that impact whole populations. So in some ways, the choices that our leaders make or don't make has major and often direct impacts on people's health, your health, my health. This affects food choices that public schools offer, the quality of the air that we breathe, the safety of the cars that we drive, even the wages that we earn in our jobs. And of course, it affects the healthcare that we all get, how affordable it is to us, how available it is to us. And of course, all of those policy choices are a result of the people that we elect. So the timing of this webinar couldn't be more exciting because we're 2 weeks out or a little bit under that from a major election that we're going to be talking about today. The connections between health and politics, I think today will be made very clear. And as we continue this series, you'll be seeing more of this come to light. In fact, I wouldn't be surprised if I heard more conversation than beyond just healthcare here. There may be non-healthcare issues that may emerge. So let me thank you for all being here. Folks online, also we have a room full of people that you can't see because of our background here. But it's important that we're all together to do this, whether you're joining us online or joining us here physically in person. You're here for something big, and I'm excited to get this started. Let me introduce the three faculty that put this event together for you and who are going to lead the conversation today. And then they're going to introduce our outstanding guests. So first, we have Dr. Walter Zelman, who is the former chair of the Department of Public Health, and currently a professor in our department. He's organized, he's the lead on this event. Dr. Joelle Wolstein is an assistant professor in our Department of Public Health. Many of our students will recognize her face from years of teaching with us. And Dr. Tony Sinay, who is a professor in the Department of Public Health and has served in multiple roles in the university. All three of these faculty have tremendous health policy experience. So with that, let me just say thank you, everyone, for being here, including Michael Hiltzik. And Walter, I'm going to hand it off to you.
Thank you very much, Greg, and thank you all for tuning in, so to speak. We are really pleased to have Michael Hiltzik from the Los Angeles Times with us this afternoon. I have been reading his columns for at least 10 years, almost always, at least now on page 2 of the LA Times. I think once or twice a week I see him at I'm always amazed at how much he can get into one piece and how much analysis and how much data and how much research. So we're really delighted to get his take on the, not so much the election, but on the relationship between public health and the economic system and our healthcare system writ large. And so I think we're all going to learn a lot today. So we have about a bunch of questions we're going to ask him. I want to say, just to be clear, we've sent him these questions in advance because our strategy here is we want the students and ourselves to get the best education possible. And the way we do that is to have people think about what we want to know. And so he has seen our questions, and rather than make him think through the answers as we give them to him, he knows what the questions are, and he's given it some thought, and we get a much better learning experience, I think, out of that. So I'm going to take the first couple of questions. Then Joelle is going to take some questions, and then Tony's going to take some questions, and then I'll come back to kind of wrap it up. And if we have time, we're going to take some student questions at the end. Okay. So my first question is, and my students are tired of my hearing about this, but economics plays a big role in healthcare. And I wanted to ask you, how would you describe the importance of economics in understanding and resolving challenges in health policy? Why are economists often so deeply involved in the analysis of the healthcare system? So many times in my own practical life, I've been told, ask the economists about that one. Why is Why are the economists so important in healthcare?
Well, I would say, that, the principle that I go by for almost anything is that economics is at the root of almost all public policy, really, of all public policy. There's nothing that it doesn't play a role in. I mean, if we talk about the debate over global warming, what we're talking about is essentially the economic impact of remedies or ways to address global warming on incumbent organizations, incumbent players and corporations, and those who are looking ahead and what the economic implications are going to be of further global warming as we go on the incumbents and on new entrants into industry and what have you. And that's where basically the conflicts come because stakeholders with one set of interests see those interests being threatened by stakeholders who have other interests, and so basically they fight. They use the vocabulary often of science and engineering, but it really is about economics. And I think that's true in healthcare, maybe more than in many other endeavors, and that's because there are so many classes of stakeholder in healthcare. There are so many with conflicting interests and conflicting viewpoints. You have the pharmaceutical industry, you have pharmacy benefit managers who are in conflict with the pharmaceutical industry, you have health insurers, you have physicians and hospitals which are not always on the same page. And in fact, I think typically are not on the same page. So that's just, the start of the stakeholders who have an interest in this. And they all, to a great extent, leaving aside patients who have their own economic interests, not just an interest in getting cured or treated, but also an interest into looking at what one therapy or another is going to cost. So basically, most of these stakeholders, the ones on the commercial and industrial side, have a lot of money, and they use their money to make more money. They use their money basically to influence policy in Washington and Sacramento and everywhere else. And they use it not necessarily because there's some principle of good healthcare at stake, but because their share of the pie is either able to be expanded or shrinking, but it's going to be affected by the interrelations of all the others. So I think healthcare, basically, economics plays an important role in healthcare, but it's much more complicated in healthcare than I think it is in other endeavors, because there are so many conflicting interests.
And of course, there's a huge amount of money at stake in all of that, all of that conflict. In what ways does the purchase of healthcare differ from the purchase of other products and services, like cars or mobile phones or food or housing? To what extent do these differences work to the benefit of consumers, and to what extent do they weaken consumer rights and opportunities? I'm thinking in part over the fact that when you go to the doctor, you don't know what you're going to pay. It's very hard to assess quality or assess price. Whereas in many of these other things, even though they're expensive, you can go to 10 different stores to see what they're selling an Apple phone for, and you can make those choices. It's harder in healthcare, is it not?
Well, I think you just used the word that puts your finger on the issue, and that is that most of those other purchases are essentially optional, or it's optional whether to buy a car or not, but it's also optional in terms of what car do you choose, what smartphone do you choose, how many do you need, what do you need, and all that. When you're talking about healthcare, people buy it when they are in essentially in extreme situations. They don't feel well, they have an injury, they've suffered a trauma. Their capacity to make choices is seriously limited, and in some cases non-existent. I mean, if you are, in a vehicular accident and you are unconscious, you have no way of choosing who's going to transport you to the hospital. You have no way of choosing who's going to treat you in the ER. You have no way of demanding that whoever you're being treated by is in your insurer's network or not. And when you emerge from this process, uh, all you know is you got a bill or many bills. I can tell you that a member of my family basically had cataract surgery some weeks ago. It was for the most part covered by our health plan, but we got four bills from an anesthesiologist, from the surgeon, and from the clinic, and somebody else. So we didn't know we didn't know who was going to send us a bill. We didn't know what the cost was going to be, except up to a certain extent. I mean, we knew going in how much of, all of these treatments was going to be covered by our health plan. Um, but other than that, we really had no way of knowing what this was going to cost. It was up to the health plan essentially to negotiate a rate if the doctor was in network or not. So we knew that we'd pay a certain copay for the initial consultation. We'd pay a certain percentage of the procedure going out, but that's all we know. So um, there's always a lot of talk about giving patients skin in the game or encouraging them to essentially basically find the cheapest or decide what price they want to pay by going to which doctor. And the reality is, because this is the reality of our healthcare system, there's really no way for most people to do that. I mean, if you have an injury or a condition that you want treated, it's just not in most people's lifestyle to go troll around for a doctor who they like or want. I mean, everyone is essentially flying blind because if you have a new condition, you don't have a doctor to advise you most of the time. You basically open your booklet and you look at who you've heard about and whether that doctor is in network or out of network, and there you are. So that's a major difference. Basically, when most people seek out healthcare, they are seeking it because they need it quickly, they need it urgently, and they don't even know necessarily what they need. They learn that once they start treatment. So.
Okay, very good. Thank you for that. Today, it seems that healthcare is always a challenge for many, but the two solutions that you hear, at least at the extremes, are to look at the need for more government regulation, including regulation of the prices, kind of the Bernie Sanders approach. He's at one end of that continuum, but some people think the answer to the cost problem of healthcare is more government regulation. Others, those are more democratic. The more Republican position is that competition will work, that we just have to leave consumers more on their own or have them go through their insurers and let competition bring the prices down and give people choices and all that kind of thing. So it's kind of the traditional left versus right debate in our society. How would you describe what you think is the best compromise between those, or is one much better than the other? And we should go in that direction.
Yeah, if we know anything, we know that in healthcare, the free market does not work. Deregulation does not work, and that's because the most fundamental obstacle to getting healthcare is price. In fact, if you go back to Uwe Reinhardt, the late Uwe Reinhardt, who he must have played a role in the Clinton.
He did.
His his seminal paper was titled something on the order of "It's the prices, stupid," and he was right. You know, price is the gatekeeper in how we deliver healthcare to millions of people. Not everybody, because as I said, if you are covered by a decent health plan, they've negotiated a price for you and for themselves, and you don't even know. I mean, the negotiations are a black box. So, we lived through the free market. The free market in health insurance, as you know, and I think most of the people here know, was a market in which health insurers were free to exclude anybody they thought would represent more of a cost to them than they thought they could earn a profit on. So we had exclusions for pre-existing conditions, and not only for serious and expensive pre-existing conditions like cancer, but for minimal conditions like hay fever, which appeared on the lists of excludable conditions on not a few health insurance companies, maybe because they thought it was a precursor to more serious respiratory issues or not. But basically, you could be excluded or upcharged in terms of your premium for almost anything. And, there were, at least 100 million, maybe 150 million Americans who fell into this trap because we were dependent on the free market. So I think it's clear, we have seen it through the Affordable Care Act, that regulating that market was essential to bring access to healthcare to a sizable portion of otherwise uninsured or underinsured Americans. And we're not done yet, because the Affordable Care Act left the insurance industry with a significant voice in how healthcare was delivered, and I'm sure you know, that was seen as a major flaw of the ACA when it was enacted, that the insurers still had a central role. So
Because
I would say we need more regulation, and the ideal would be to move towards single payer, where the payer is the government. And I can't tell you when I think that nirvana will be reached, or will reach the top of the mountain.
Well, thanks very much. That's a great answer. I'm going to turn it over to Joelle, who's going to ask the next couple of questions.
All right, so sticking with the topic of cost, but focusing on a more specific issue. A few months ago, I believe it was in August, you wrote about healthcare challenges related to obesity, and you noted that some new drugs, specifically Ozempic and its cousins, as you called them, were proving to be effective in addressing obesity, but they're very expensive even for those with insurance. How would you address this challenge and opportunity? And do you think there are policies that should be considered or adopted?
Well, the problem that I tried to pinpoint in that column was that what we knew about Ozempic and Ozempic related drugs is that they are extremely effective in bringing about weight loss, and that addressing obesity or even overweight, had manifold benefits down the line. It would keep people from moving into pre-diabetes and then moving into diabetes, which is an incredibly expensive and costly, not only in terms of dollars and cents, but in terms of life experience. It would have enormous beneficial influences on cardiac health and all sorts of things. We've heard that these drugs may have effect on the prevalence of Alzheimer's and other forms of dementia. So they're very useful drugs. They're the closest thing to miracle drugs, I think, since the hepatitis C drugs of some years ago, which also raised similar issues. But the problem is that if your health plan covers these drugs, they are paying right up front for the cost of them. And in a sane world in which, we had one payer paying for everything, the cost benefits of having fewer of these costly conditions would redound to the same payer. So any payer that, let's say Medicare or the government could say, well, we're going to spend $1,000 a month or what have you on Ozempic every month now, but down the line, we're going to save much more money because we're not going to need to cover dialysis for as many people, or just, general diabetic care, or any care. We don't have that because, Blue Cross, if it were to pay today for Ozempic, by the time that customer experiences experiences the benefits of being on that drug and losing weight, he or she is likely to be a client of some other insurance company or of Medicare or Medicaid. So there's no percentage for the initial insurance company to cover these drugs, and that's why we have situations where the health plans all put limits on who they will cover for Ozempic, just as they used to put limits, I think they still do, limits on who they will cover for the Hep C drugs. They know they're going to be charged a lot of money for the initial treatments, and they don't know if they're ever going to see the benefits down the line. In fact, I think they can assume they will not. And the only way that they have to deal with this imbalance is by limiting the number of customers who they will cover for these drugs, or for any other treatment that has this long tail of beneficial effects down the line. So basically, that's the fundamental issue with obesity. I mean, obesity generally is a very costly condition over a lifetime. So it's clear that these drugs will have social benefits that are significant, but you are not, under our system, you are not going to be able to persuade commercial health insurers to cover them with the breadth that they need to be covered.
Oh, great answer. Thank you. We hope to get in all our questions and give the students some answers. So if we could keep the answers a little bit shorter, so we can get everything in. That was great. Thank you. Joelle, you have another one.
Yeah, I have another one. So this one is directed towards the students. The question's for you, of course. So many of our students who are attending today's webinar are public health majors. How do you view the role of public health in the larger healthcare system? Are we investing enough in public health?
Well, the short answer to that is no. We are not investing in public health to anywhere near the degree we must. And I think we saw the consequences in the pandemic, where our public health infrastructure was basically overwhelmed from start to finish. And another aspect of that, or another feature, is that the attacks from the right on public health um, policies basically has undermined the credibility of public health practitioners and discouraged, I think, a lot of people from basically from entering the field. And I think that is a real shame.
Okay,
Thank you.
I think, Tony, I think you're up next.
Yes, I have the next couple of
Okay.
questions, Michael. Healthcare is often a major issue in presidential elections, but this year that doesn't seem to be the case. Until very recently, when Vice President Harris expressed views on expanding home healthcare in Medicare, neither candidate was raising healthcare as a major issue. Do you have any ideas as to why this might be the case?
Well, I'm not sure I agree with the premise. I mean, I think the debate over women's reproductive health is very much front and center in this campaign. Certainly, Harris has made it so, and I think she can see, as we all can, that this is a truly important issue for not only women in the electorate, but their husbands and parents and and families more generally. We've seen since the Dodd's decision in 2022 that ballot measures to expand or protect reproductive health rights invariably win, and they win big, even in red states. And I think the Democrats recognize that. So I think they haven't. So I think they've talked about it quite a lot. I mean, Trump has talked about it, but of course, he's faked it. He's claimed, and Vance has claimed, that he saved the Affordable Care Act, which is absurd. He claims that he's going to protect women, which is absurd. And I'm sure he doesn't want to talk about that this much because his record is just egregious on healthcare from when he was president. But I think Harris has been pushing it pretty hard. I mean, she's given interviews and rallies on this very subject. Now, in terms of we may not see her or Trump talk about the more complicated issues like single payer, universal health care. But the issue that most people are really focused on right now is reproductive health care. And I think Harris has addressed that pretty firmly.
I just want to interrupt. I think that was a question I suggested and talked over with Tony, but I agree that abortion obviously has been a critical issue. I think I was in that question aiming more at the broader kind of healthcare system, like the single payer, access, costs of healthcare, all those kinds of things, rather than this specific issue of abortion.
Well,
Obviously,
I think that's fair. I think this doesn't become sort of a soundbite issue for rallies, which is probably unsurprising given that it's complicated. And with healthcare, public policy creates winners and losers, and sometimes it's not clear who the winners are and who the losers are. So it's safer for a presidential candidate to sort of speak in generalities. But she certainly set forth policies in her written statements and on her website that she's going to continue the advances on the Affordable Care Act that were instituted under under Biden, including remaking the subsidy formula so that there's no cliff. You know, you don't get to a certain dollar of income and lose all your subsidies. It's much more sensible, and it's something that I think everybody knew from the inception of the Affordable Care Act. These were known flaws. Everyone knew they had to be fixed, and it took until Biden to actually start fixing them.
Thank you.
Here's my
Tom?
next question. Right. What do you see today as the greatest strengths and weaknesses of the U.S. healthcare system? And what policies would you advocate to address the weaknesses?
Well, I think the greatest strengths are basically the high level of education of our healthcare providers and practitioners, the incredibly high technological level of our healthcare system in terms of the equipment and the treatments that are there. The major weakness is a question of how to ensure that everybody who needs these treatments and therapies has access. And this is what we've been talking about throughout this webinar, is that cost is an obstacle, not just the cost, to the end user, but the cost imposed by pharmaceutical policy, pharmaceutical the pharmaceutical industry. We had a situation where providers like physicians would invest in equipment and then basically, try to make their money back by unwise or excessive prescribing. And I think we've addressed that by basically not allowing those sorts of arrangements. But it really is, we need a way essentially to regulate costs as they come out of the creators of these technologies and as they're imposed on patients, because that's really that's the flaw, the major flaw in the American system that results in our spending the most of any developed country on healthcare and having the worst outcomes.
Okay.
Thank you, Michael.
Joelle, I think you're up now again.
So if a student, faculty member, or anyone really went up to you and said they wanted to be involved in generating change in the US healthcare system, what advice would you give them?
Well, I'd say not to be too jocular about it, but run for Congress. That would help. I've talked to a lot of scientists and physicians over the last few years, over the pandemic years. And there's a great deal of frustration that I hear from those who actually have hands-on experience with COVID, with treating patients, with basically trying to encourage sensible social policies with the pandemic, sensible public health policies. And they're very frustrated that they simply do not hear our government public health agencies speaking out. They don't see their own professional organizations speaking out to protect the principles that we know lead to better and more effective public health. So I think, that's just an endemic problem. I don't know what the solution is. That the people I talk to, who are some of the most distinguished scientists and physicians in the country, they're just frustrated. They don't have an answer themselves. So I'm not sure I can give you one, but that's where the problem lies. It's in the reluctance of professional societies and organizations and government agencies to really step up and fight for the principle of public health.
I've always thought, just to add that, I've always thought that one of the problems was that there's so much emphasis in our healthcare system on high tech and great surgeries and people coming out of the hospital and they got cured, and so much focus on the medical side that public health becomes kind of a stepchild to that. Public has never gotten to understand its value in a sense. I keep wondering, there are 100 television shows I've seen about doctors and hospitals. I've never seen one about somebody working in public health. I think there was one 20 or 25 years ago, but I can't.
Well, I'll tell you two quick stories. One is that I am the father of an orthopedic surgeon, and who's at the beginning of his career. But my wife has become addicted to all these medical shows, and I have a very, very good friend who was a producer and writer on ER. And my wife is constantly complaining that orthos are never portrayed in these programs. How come? So that sort of talks to the way we think about these things. Now, the other point I want to make, which I think is more important, is that it was made to me by vaccinologists and public health officials, and in conversations I've had as recently as the other day, is that the thing about public health is that the benefits are invisible, that you don't realize what the public health infrastructure has achieved because it means that we don't have a problem, that they've addressed the problem and made it not a problem anymore. And as a result, it's easy to sort of talk about the costs of public health policies. And because the conversation never goes to balancing those costs with the benefits, because it's hard to explain what the benefits are. And, Paul Offit, who's a prominent vaccinologist out of the University of Pennsylvania, talks about, when I talk to him about the anti-vaccine movement, he says, well, vaccines have been their own worst enemy because, it's easy to sort of say, well, who cares about measles? Because vaccines have almost eradicated measles, or almost did. Now we're seeing it again. And the same for polio. And we know that the only disease that's ever been eradicated is smallpox. But so people became inured to the idea that we didn't need vaccines because who gets measles anymore? And if, a child in the US gets measles, we can treat it, and they don't die. So that's sort of a permanent, ineradicable problem for public health. And I don't know how to address that except through public education.
Right. I think, Tony, you have one more question?
Yes, I do. What do you think would be the biggest differences between Harris and a Trump presidency? In particular, what different views would they bring to the health policy challenges the nation faces? And the last part of the question is, what priority would they place on improving public health?
Well, I think we know the answer to that question because we've seen Trump in action. The answer is Trump would place no priority on improving public health. He would do nothing. He would let whatever's left of our public health infrastructure wither away, and he would congratulate himself for doing so. Harris, takes a serious approach to public health and healthcare generally, and we've seen that by her commitment to the Affordable Care Act and her commitment to women's reproductive health rights and all that. I mean, it's a little hard to even think of an area in which these two candidates are further apart.
Okay, great. I think that more close to gets us to the end of our list of questions, except for maybe the toughest one. You don't have to answer it if you don't want to. Who's going to win?
I think I mentioned
Who do
before
you
this.
think is going to win?
I think I mentioned before the webinar started that I gave, I got out of the business of election prognosticating on November 6th, or maybe it was 7th of 2016, when, we were all, at least I was, and everybody I knew except for one colleague was confident that it was all over and Hillary was, a shoo-in. And then we woke up and the world was different. So I don't know. If I had to guess, I would say that the margin between these two candidates has been understated, and that Harris has a lot more support. That the vibes are on her side, essentially.
Okay, thanks very much. And lastly, if people
But
want,
I would say
Yeah.
one more thing, which
Sure.
I've pointed out many times, and it's often said, and I don't know where this principle is or comes from, that there are two components to people's perception of risk. One is how bad things will be if something happens, and the other is how likely is it that that thing will happen. And humans tend to focus on the first rather than the second. So I think many of us, many of the people I know, are focused on what the consequences would be of a Trump victory more than what is the real likelihood of a Trump victory. And the first makes the second look a lot more dire.
okay, thanks very much. And finally, if people want to get your column more regularly, do you have a place they can go to get it so that they could read it without maybe having to subscribe to the LA Times, which students can get for free? I think.
Well, I don't have much of a voice in that. I think, we have a paywall, and the paywall covers my column, but my impression is, and maybe I'm wrong about this, that even with the paywall, readers can access a certain number of articles per month before they're told now you have to start paying. And I don't know what that number is. And I don't know how it works, and if it still actually is true, or if they have to pay starting with Article 1. But that's really the only way is at some point you have to start paying to read me.
But I do believe that students can get it at Cal State LA. I think they can get it for free. The LA Times and the New York Times and a few others, I think.
Well,
Guaranteed.
and I would encourage students who have that access to subscribe not only to the paper version, but to the online version, because I actually write more often than my columns appear in print. My columns appear in print twice a week, sometimes very occasionally a third time, but I write 3 or 4 columns a week.
Okay, Joelle, do we have some questions from students?
We have one, but there's time for more if anyone would like to submit a question. So the first one is, recently, the clawback of COVID funds by the federal government have left some local health departments in limbo with funding.
I'm sorry, I missed the first part of that.
Okay, recently, the clawback of COVID funds by the federal government have left some local health departments in limbo with funding. Is there any movement on possibly adding more funds to public health programs locally or federally?
I don't actually know the answer to that. I mean, the clawback, if I understand correctly, is sort of an artifact of recipients not spending the money, or not making a case for the money. So to a certain extent, the recipients can do better. But I think it's certainly true that the government at the state level and the federal level can do better in terms of making sure that essential services and essential policies are supported financially.
Okay. Do we have any other questions? Did we leave anything out that you wanted to tell us? That students
no.
might be interested in particular? Students might be interested in.
I think we've covered everything that was on my agenda and maybe yours. So, but I'm open to, questions about anything.
I have a question for you that we asked our last guest. So we were wondering if you could encourage students to get out and vote and why this election is so important.
Oh, I would definitely encourage students to register and to vote. I mean, this is the ramifications of this election, are going to affect everyone's lives for decades to come. I mean, we know that the judges that Trump put in place starting, 4 years ago are still working their black magic on U.S. policy in so many ways. And I think, with this election, we can maybe can stem that. But in so many ways, this is an incredibly important election. The most important one in my life, I think, since the Reagan election of 1980.
We have another question from the audience. Could part of the solution to drug company profitability be addressed by extending the patent exclusivity period?
Well, the patent issue is an important issue. I look at it in a somewhat different way. The way I look at it is that we know, because it's been documented, that the vast majority, and I think 90% or more of the new drugs that come onto the market were developed in part with public funds, National Institutes of Health, National Science Foundation, Department of Defense. I mean, there are, so many sources of federal funding. And there is a law in place, it's the Bayh-Dole Act, that anticipated, that basically put in place a system in which private companies, private developers could profit from products that they brought into market that had been partially funded at their inception, maybe in the research stage, sometimes in the development stage, with federal funding. But they reserve for the federal government the right to march in, as the term is, to basically take over the licensing of a drug that was developed with federal funding and make sure that access is provided and that the price is reasonable. There has not yet been a case in which the federal government has marched in and exercised its influence on the marketing of a drug, either through price or basically co-licensing to competitors to the principal licensee. And that basically we need to start doing that, because as I said, the price is a major obstacle to access. And there are any number of drugs, and there are going to be more as we move on to genomic R&D, drugs that basically break the bank. They're getting more expensive. They're getting ridiculously expensive in terms of how much they cost per year. And this is a perfect case where the federal government can exercise rights that it already has and basically provide a counter balance to the sort of freewheeling pricing that pharmaceutical industry enjoys today.
I have a question about something you said earlier about the strength of all the lobbying organizations in the medical, under the medical umbrella. Years ago, I worked for Common Cause, which, as you know, is an organization that focused on public financing of elections and getting the big special interest money out. Today, that money has exploded in ways that none of us could ever have thought in decades about. When you think about the clout of potential clout legislatively with candidates and lobbying and stuff of public health really has no private interest competitor followers that can match, anywhere near the money that's poured in by the medical industry and other industries. And do you think, a limiting factor in its capacity to impact public policy and public health? And if it is, what can public health do without that major tool?
Well, I don't know how public health can ever acquire, as a, entity, it can ever acquire the resources to compete with these other companies, with, private companies on the other side. But of course, we know what one of the main problems was the Citizens United ruling from the Supreme Court that basically took the limits off what corporations and industries could invest in elections. You look at the donation lists for almost any member of Congress. Healthcare industries always rank very high in terms of how much any candidate gets. And then when you look at the lobbying expenditures, which are not under anybody's control, they're just enormous. And I use enormous, to signify something that's big and bad. So this is basically an obstacle to getting regulations on these industries that would bring prices down, because they're not going to stand for it, and their agents and mouthpieces on Capitol Hill know where their bread is buttered, and they're not going to support it. So I think we need to break the cycle of corporate contributions to political candidates.
And if we can't break that cycle, what's public health's best lever, do you think? What can we do as an entity to try to not necessarily counteract that, but come up with something else that makes the
well, the real problem, I think, if you really drill down, the problem that public health had during the pandemic and even somewhat before, was that there was no leadership in Washington to support it. In fact, when the pandemic began, the Trump administration basically did everything it could to sort of denigrate public health, denigrated public health policies in the crudest way. I think if we had different leadership in Washington under the same circumstances, they would stand up for public health policies and support them rather than undermining them. So you ask about the significance of that election. That's one right there.
Thank you. Well,
Right.
one last question from
We actually have two. I
Okay.
think there's enough time. One is, with the homeless crisis getting worse, what are some things the government and public health could do to solve the issue?
Well, homelessness is something that I write about seldom, because it is really sort of an intractable problem. And that's because the causes of homelessness are so varied that it doesn't respond to any one remedy. You have to address, all sorts of causes. And there's just at the moment, I think it's beyond the capacity of our political leadership to bring it all together. Homelessness is one issue. There are other issues that we have reason to question whether the political system is up to the task, but certainly it's that one. And it really is because it's so hard to pinpoint what the causes are of homelessness. I mean, you can say, well, we're not building enough houses. I'm not sure that's really true. We can say we don't provide enough mental health care for people who end up on the streets. That's true, but that's just one aspect of the problem. And there are, just countless other reasons that we have homelessness. I mean, in this community, we have more homelessness than you find elsewhere because the weather is accommodating, the climate is accommodating, more than it would be in, Minnesota or Maine.
Okay, the last question from the audience is, what has been the most interesting or surprising or infuriating thing about the election so far?
Well, I blame the press. I think the inability of our major newspapers to sort of come to grips with what's going on with one particular candidate is really damaging to the country. You may have heard the word sane washing, which is trying to reduce Trump's blathering to something that sounds sane. I don't know why my colleagues in the press, and I think that the LA Times has done better than some other major news organizations at dealing with this, but I wish we did even better than we have. But the failure of some of our major news organizations to really, depict the world that's out there has been extremely disappointing and frustrating. I try to do what I can, but I'm only one guy with one column.
So, Michael, thank you again so much for giving us your time today. And now you can go back and write some more pieces.
Okay. Well, thank you for having me. This has been a great joy. So I appreciate the opportunity.